Good. Sure.
Okay, we're just gonna wait, I think, until a few more people arrive and then we can get started.
Good morning, good afternoon, and good evening, everyone. Magandang umaga sa inyong lahat. Thank you so much for coming to today's webinar, Usap Tayo. My name is Krista, and I'm here with my friend Clara, and we are part of the Filipino Young Leaders Program, or PhilPro. So PhilPro is founded the program Tayo, which is the organization, which is the program that is putting on this event called Tito, Watch Out for Gout. Tayo initially started in 2020 as a COVID-19 help desk fighting medical misinformation, but has since grown into its own program providing mentorship and promoting awareness for a variety of health issues beyond COVID-19, such as vaccination and today's topic, gout. So on behalf of PhilPro and the Tayo Help Desk, we have the pleasure of co-hosting this with our very own medical advisor, Dr. Isa Palma, and our amazing Tayo director, Lizelle Tanglao. Special shout out to our partners for their support and help in helping us put this on.
Thanks, Krista. Yeah, so again, my name is Clara, and today we have a really special guest, Dr. Solon, who will be talking about gout and the Filipino community specifically. and also related resources and the latest information for our kababayan. And then we will conclude with a Q&A session, which will include this like conversation with some community members who we will introduce later. But if you have any questions throughout the webinar, feel free to put them in the chat. Krista will be monitoring that, and we'll try to address all of those at the end if they haven't been answered already. And also, I wanted to offer a little disclaimer that the purposes of this webinar are strictly educational, not intended to be specific or personal medical advice. But we really hope that you do get something out of this. So to kick things off, we have a few videos that we'd like to sort of play to get us in the mood for some, hopefully some humor and some interest around this topic. So let me just stop sharing my screen for a second and then reshare really quickly.
Tito, mano po. For old people, you know, I'm like you know, like TikTok. Espresso, diba? That's wrong po. Please, Tito, just one mano po. Oh, you want the sige, potassium. Tito, are you crying? Please, Tito, bless po. Mama said bless anyone with white hair. No. I'm so young. But you have gout.
And just one more video, again, to bring some humor to today's webinar.
Gout before? I have. To think that food I could eat enough. And I used to think that I was immune to gout. But one smoke taste of prawns, now it's flaring out. My toe is now in pain, what's this all about? I've eaten beef and more red meat, and both my feet had no difference. Now I'm burning from the Philippines, so it's either this or diabetes. Oh, yeah. Never knew that I would get it, but I knew once I'd start limping, my God. Never knew that I would get it, soon I knew and now for me, ooh, yeah.
So I hope everybody enjoyed that little brief intro, but now we'll get into our presentation by Dr. Solon. So I'd first like to introduce her. It is my pleasure to introduce Dr. Agnes Solon-Ashby. She graduated from UP undergrad and med school, did her residency at Mercy Hospital in Chicago, and her rheumatology fellowship at the University of Illinois. She and her family have been in Louisiana since 1994, initially just to do her J1 waiver, and eventually decided to settle there. Her husband is an internist, and they have a son who has an MBA and a daughter who is practicing law in New York. Welcome, doctor.
Thank you. Thank you for having me. I've never heard of you all until now, and I'm so proud of all of you, and I'm so glad I got to know you. But so thank you for the invite. I think this is a very relevant topic, especially for Filipinos. My patients actually call it gout because, as you know, for any gout patient, it comes with a big ouch. So I'm trying to make this lecture or webinar more relevant to the Filipinos because it actually is one of the more not famous, common arthritis in the Philippines. So the most common arthritis is osteoarthritis or wear and tear, but Filipinos have a lot of prevalence of gout. So my objectives are to define what is gout, and how to specifically avoid it and what to do when you have it. And I'd like to iron out myths and facts. So for example, that first video where you said, "Mano po, Tito." So he says, "I'm not old." And then the other guy says, "Well, you have gout." So I'd like to clear up a lot of those little myths that we have, and hopefully a better understanding will make us deal with it better. So I have to excuse myself. I don't speak Tagalog very well because I'm from Cebu and my Tagalog is really iffy. So pasensya na ho kayo. So, Clara, can you move on to the definition? One more. So by definition, gout is an inflammatory response to monosodium urate crystals. So MSU crystals are the uric acid crystals. So to clarify, each of our joints is a compartment. What happens in gout is mataas yung uric acid sa blood, so it seeps into the joints. So when this uric acid crystals seep into the joints, the body responds by causing inflammation. So that's why it's called gout, because any joint that's involved becomes very, very inflamed, red, hot to the touch. My papa used to have it, and he wouldn't even want to have the sheets over his foot because it was very painful. So my patients who call with flare up, they'll come in either in a wheelchair or on crutches without any sock or anything on because there's nothing that they can put on that is not painful. So the incidence is actually 56 million worldwide. And it does occur in older adults, but I have some patients, males especially, who are in their 20s and 30s. Females don't get it until after they menopause, unless of course they've got some abnormalities in metabolism, so they can't metabolize uric acid. So females are not immune. We'll catch up. So next, please. So I have a few pictures here. So the picture on the left is podagra. So podagra by definition is gout in the big toe, which is one of the more common areas where we usually have it. The one on the right, they're actually tophi. So tophi are yung mga tao na that they've had gout for a long, long time. So they have these little white nodules that deposit on the fingers, on the elbows, any other joint talaga that has been involved. And sometimes when they flare up, usually the tophi are not painful, but when they have a flare up, it becomes red and extremely painful like this. So you can imagine how debilitating it is. Next, please. So this is what happens. This is a little diagram. So this is gout in the big toe. This is podagra. So on the right, in that red circle there, you see those needle-shaped crystals? That's what causes this. So there's accumulation of these needle-shaped crystals. And then what happens is the white blood cells come to the joint. They try to engulf these crystals. And that's what causes the pamaga. Now, gout can be, or almost always is, self-limited because after a while, if the white blood cells engulf all the crystals, then it cools down. But that can take anywhere from 5 to 7 days. So that's why it's debilitating. So some patients will say, yeah, that happened to me, pero I just lay down and then after a week nawala. So that is possible, but that's the whole point, is you want to avoid inflamed joints like this because eventually they will cause damage. Next, please. So what are the risk factors? In Filipinos, it's common kasi look at naman our diet. So it's usually red meat, like we said, inside, I mean, organ meat. So dinuguan is like very, very common. Um, we like our San Miguel, we like sugary drinks, and then lifestyle. So people na kulang sa exercise or people with diabetes or people who are obese, they're predisposed to gout. Now, family history, sometimes you can trace it, sometimes not. That there is a condition na the patient cannot metabolize uric acid. So that's when it's really more common now. Oh yeah, my dad had it or my brother had it. But it's not unusual because we all have the same diet. So it's not unusual that you can trace other family members who have it. Next, please. So what happens? Like I said, so biglang atake sa big toe, that's called podagra. But other joints can be involved, pwede sa wrist, sa shoulders, sa knees, sa ankles, sa midfoot. And then I actually had one patient who had it in his spine and then in the hip. So like I said, uric acid crystals invade the joints. So what happens is namamaga, namumula, and it's very hot to the touch. A lot of times it's after a heavy meal or an alcohol binge. Most patients with gout can identify what brings it on. Like here in Louisiana, we have crawfish boils. So some people eat 5 to 10 pounds of crawfish. Tapos they have to drink beer with it. Sigurado yun, the next day they'll have an attack. Now, so that's the acute gout. May chronic gout, so patients who always have high uric acids eventually will develop yung mga bukol, that the white bukol called tophus or tophi, plural. Sometimes they can also develop kidney stones. So that's another important reason why we have to control the uric acid. Next, please. Oh, I wanted to point out signs and symptoms. Most of the time, gout attacks happen at night. So they go to bed fine. Tapos like 3 or 4 o'clock in the morning, they'll wake up. Ang sakit-sakit. So there's throbbing joint pains and everything. So why does that happen? It depends on the acidity of our bodies too. Kasi di ba when we sleep, our respirations go down, so we'll have higher carbon dioxide levels. So that changes the pH of our body. So that's one of the reasons why most gout attacks occur at night, or we wake up with a gout attack. The other reason is in the evening time we have very low cortisol levels. So cortisol is a kind of steroid in our body that works as an anti-inflammatory. So when we have lower cortisol levels, that's when we have a lot of inflammation, especially kung mataas nga yung uric acid. So this is a picture of a tophus. So this is a big toe na maraming episodes of podagra. So eventually, this does not hurt anymore. You see the difference? It's just kind of darkish. It's not red anymore. But you can imagine putting this foot in a shoe. So it's uncomfortable. And then sometimes, if it gets irritated, sometimes white chalky fluid seeps out. So that's what's inside this. Now, if I put a needle in there and drain it, sometimes it can drain out. But then again, with another episode, more deposition occurs. It can also come out this little white, I wish I had a pointer, but you guys see this little white specks on the, yeah, thank you. Right there, those are tophi. So they can also deposit there in the ears. Sometimes they can deposit in the elbows, sometimes in the ankles. Sometimes I have a patient who has a genetic deficiency of metabolism for uric acid. So she has tophi in every one of her fingers. Next, please. So what are the risk factors? So like I said, age can be a risk factor, especially in women after they menopause. Men can be anywhere from 30s to 50s. Sex, like I said, males are more predisposed until females undergo menopause. Ethnicity, we're right there. Asians, Filipinos, Thai, Koreans, African Americans have higher predisposition to gout, and then there's genetic variants, like I said, people who can't metabolize uric acid. So obviously we can't modify these risk factors, but we have a lot of modifiable risk factors that we can work on. So obesity, obviously, high blood pressure, kung mataas yung cholesterol, metabolic syndrome, diabetes, chronic kidney disease, And then our diet, our alcohol intake, and sometimes medications too. So we can have patients who take a lot of diuretics, so that can sometimes predispose it. Some chemotherapy medications can also cause attacks. So how do you diagnose it? Obviously, from a history and physical examination, um, a lot of times you don't really need the uric acid level because it's obvious. They'll come in and they'll say, I was fine yesterday and then I woke up, can't walk because my big toe swollen or my wrist is swollen. Sometimes, and this is not anything that is out of the ordinary, but patients will go to the emergency room with what looks like a gout attack, and then they get a uric acid level, and sometimes it's normal. So then they get told, oh, this is not gout, because a lot of times the blood uric acid level may not necessarily correspond to what's going on. So what you really need to do if you want to establish the diagnosis is drain the fluid, tapos look at it under the microscope, and you'll see those crystals. There are certain tests for inflammation like the SED rate and CRP. This go up significantly if one is looking to make a diagnosis also. X-rays are not necessary kasi unless of course you're suspecting a fracture or something, because a lot of times you're not going to see anything on the x-ray other than soft tissue swelling. Or if it's chronic, I'll show you an x-ray picture of a chronic gout. So imaging is not necessary. So it just shows you that it's very important to keep up with your checkups, especially if you've had the first attack. So treatment, pain relievers, so non-steroidal anti-inflammatories, mga ibuprofen, Aleve, naproxen, will help. But a lot of times, kung grabe yung attack, it doesn't go. The anti-inflammatories orally don't go very far. Sometimes steroids, so you can take steroids by mouth, or you can get a steroid injection. A lot of times, if a patient comes to me, tapos their knees really maga or their wrist, I try to drain the fluid and then inject steroid into the involved joint para hindi naman the steroid doesn't go all over. So colchicine is an old drug, but it works for acute attacks. Because what colchicine does is it quiets down the white blood cells. So, di ba, remember the white blood cells are the ones that cause the inflammation. So, if you take the colchicine, you can quiet down the white blood cells and subdue the attack a little bit. Colchicine is toxic. When I was doing my training, we used to give colchicine every hour on the hour until you get diarrhea or vomiting. But we ended up causing a lot of kidney problems then. So now the dose is just 1 tablet twice a day. And you don't necessarily have to do it for a prolonged period of time if your uric acid stays controlled. So I have this little thing here. It says, wag tiisin ng sakit, magpatingin. Next, please. So there are long-term medications like allopurinol is the most common, and febuxostat or Uloric is another one. So colchicine cools down the attack, right? Allopurinol controls the uric acid. You want to have a uric acid level less than 6. Now, little warning, sometimes we go to urgent cares or ERs, and then the whoever practitioner sees, oh, it's gout, looks like gout, and then they get a uric acid level and it's like 10, for example. They give the patient allopurinol. What that does is it just prolongs the attack. Kasi if you also have rapid decreases of uric acid in the blood, that actually prolongs the attack. So allopurinol is good for maintenance, but it really doesn't have a role for an acute attack. Hopefully, if the patients on allopurinol or Uloric for a long period of time, they stay under 6. Hopefully, you won't need anything acutely. So like I said, colchicine is not tuloy-tuloy. It's helpful for an acute attack and sometimes maintenance, but the maintenance dose is a lot lower. Allopurinol and Uloric are the ones that we usually use for prolonged use. So tuloy-tuloy, hindi lang kung namamaga. So that's the whole reason why you want to keep your uric acid down so that you don't have repeated attacks. Next, please. So this isn't very clear, but you see this dark portion here, the top, please, right there. You see that? That's called a rat bite erosion. So this is what happens in patients who have repeated attacks of gout. Every time there's an inflammatory process, namamaga yung joint, at some point there's going to be bony erosions there. So that's exactly why you want to prevent repeated attacks, because it can be very destructive if you have very many attacks like this. So this is an x-ray of the big toe that's had repeated podagra episodes. So I wanted to point out, because it's very common among Filipinos, there's actually a gene marker that's called HLA-B5801. If patients have this, then allopurinol is not recommended, because patients with this gene marker, when they're given allopurinol, they're the ones predisposed to having Stevens-Johnson syndrome, which can be deadly. So it's like an allergic reaction, but it manifests as a GI bleed. It can cause kidney problems. It causes this severe rash all over. I had one patient that had to be transferred to the burn unit because every single part of his body had a rash and ended up talagang weeping rash. He had so much open skin. There's also another syndrome that can occur as a side effect if patients are predisposed to it. It's called DRESS syndrome. And what happens is patients will develop a rash. They have high fever. They can have hepatitis. So like talagang namamaga yung liver, and sometimes renal failure. So the eosinophilia is the kind of white blood cells that go up when one has an allergic reaction. So Uloric is good because it doesn't have as much kidney clearance than allopurinol, but there's also some data about increasing cardiovascular risk. So patients with heart issues and diabetes, I mean, all these patients who have cardiovascular issues, you kind of want to stay away from febuxostat or Uloric. Your choice would be allopurinol. Pegloticase is Cristexa. It's an IV medication that works very quickly. So you give it you administer it in an infusion place, of course, and this plays a role in patients who are really hard to control with just allopurinol or Uloric, and people who have huge tophi that are debilitating. You can give these patients pegloticase. So I put others there because sometimes these medications can also cause decreases in gout episodes. So losartan is a blood pressure pill. It has effects of us urinating out the uric acid. So it's a uricosuric agent. Atorvastatin and fenofibrate are used for cholesterol, and they can actually have lowering uric acid effects. Not too much though, but it's parang icing on the cake. So allopurinol and febuxostat pa rin ang mainstays. I just had some pictures. So there's allopurinol on your left, Uloric on your middle, and then I have a picture here of a knee aspiration, because as many of you know, if you've had an attack, your joint can magnify to like 10 times the normal. And of course, if it's maga, then you can't move it and it's painful. It's just not painful, it's immobile. You can't flex or extend this knee. So we can aspirate the fluid, and then after aspirating, we can inject the steroid. So the steroid actually stays on the involved joint, doesn't have to go all over the body. So this is really important. Lifestyle modification is important. So knowing what foods to avoid helps, goes a long way. So grains, oatmeal, wheat bran, wheat germ, vegetables, asparagus. I mean, you can read that, cauliflower, peas, mushrooms, mongo, lentils. I love mongo, but if you're predisposed to it, then that can also make you develop gout. Organ meats or laman loob, seafood, and wild game. Now, we're all made differently, di ba? Our metabolism is all different. So you can have patients who say, pare, let's inuman tayo. Hindi, may gout ako. But sometimes it can affect people more, I mean, some people more than others. So these are some of the more common foods that are, that can cause it, but doesn't necessarily mean that it happens to everybody. So alcohol, especially beer because of the malt, and then soft drinks and sugary drinks. Um, so what do? You increase your water intake, you increase your fruits and vegetables that are safe, increase fish so that you're lessening your red meat intake, except sardines and mackerel. Exercise, it's not just good for gout, it's good for everything else. And then weight control and controlling your blood pressure, of course, and managing the other diseases that predispose you to developing gout, like heart disease and kidney disease. Next, please. I had to put this. I had to put everything that's good that's bad for you. Um, Alcohol and dinuguan and shrimp and sardinas and lechon and asparagus. I couldn't fit any other things, but there are a lot of things in our diet that we love to eat that can predispose us to developing this. So myths. Gout has no cure. No, gout is curable. It's in fact it's very preventable and it's controllable. So maintaining a uric acid less than 6 will prevent recurrent attacks. Bawal ang beans and gulay. No, just certain beans and gulay. So just be aware of which food items you're predisposed to, developing an attack. Some people have said dahil sa pasma or sa lamig, and that's not true. You all know that it's because of high uric acids that seep into the joint. That's what causes gout. I think this is my last slide, right? Yeah. So, okay. So I hope that clarifies a lot of things about gout, and please ask questions if you have any.
Thank you so much, Doctor. So before we launch into our discussion, I would like to introduce two of our other panel guests, two community members um, who are also from Tayo, Mark Calaguas and Joshua Ang Price. So I'm going to stop sharing my screen just so we can get a better view of everybody um, and yes, to Titos from our community, and I would just like to start by asking you two to tell us a little bit about your experience with gout, and then feel free to branch out into asking Dr. Solon questions or each other. Yeah.
Mark, do you want to go first, or do you want me to go first?
Okay, I can go, sure.
Okay.
Hey everybody, Mark Calaguas. I'm logging in to you tonight from Metro Detroit. I'm also, from Chicago. I am a co-founder of Tayo and was a member of the 2016 PhilPro Immersion Program. Okay, so my experiences with gout. So I was one responsible for those clips because I think I kind of check some of the, I guess, more stereotypical, markers of somebody developing this condition. I was formally diagnosed the week I turned 40. So if we kind of flash back, this was during, the peak of the pandemic. And so a lot of people, we were stuck at home. And I think a lot of us, to pass the time, to cope, kind of indulged a little. This was the era of Zoom happy hours, right? Kind of just no regard for, what time of day it was, you could easily take a break and, knock back a few drinks. And then I also kind of spend that time kind of brushing up on my kind of cooking skills, right? So I think that was actually a pretty positive experience. I got to learn a lot. But I was pretty indulgent in, the ingredients that I brought in and cooked with, right? So, I never had any issues, with diet up until that point. I was never allergic to any foods, thankfully. Um, but my only, I guess, red flag then was, my cholesterol started, getting elevated. But I think that was just due to me just not really watching what I ate, right? And it was during that week where, I had three different celebrations, because it was a milestone. And right before the third day of celebration, I, felt just an extreme, gradual pain. It started off as a throbbing, before I went to dinner, by the time I came back from dinner. So nighttime, as Dr. Solon kind of indicated, it started like hurting a lot more, to the point where, it felt like, a fracture, and as a runner, I had already had stress fracture and tendonitis before, and it felt exactly like that. And so it took me a while to realize what was going on. And it actually took me like 2 weeks, because it wasn't on my radar. Gout, I kind of thought that, I was too young, at that point to kind of develop it. And it mimicked, some conditions I had before, right? So I just kind of took painkillers. I did go to urgent care, and, nothing, it didn't really trip them off, until I finally made an appointment with my podiatrist, who treated me, when I had my previous running injuries. And the second he looked at it, he said, "Oh, I think that's gout. Okay, let's just run some tests and let's confirm it." And he did. Um, and that's when I started getting all the literature, all the guidance of, the things that I should avoid, other kind of lifestyle changes to minimize myself, getting flare-ups, and the like, and a prescription, right, for that. So I'm taking allopurinol, and I'm also on cholesterol meds, so atorvastatin is also part of that mix. Some of these conditions, right, they kind of just like coexist with each other, thanks to lifestyle. And definitely, like, I cut down on my drinking a whole lot. Uh, Beer certainly, because I think that's the one you hear about the most. So, there's a big consensus of that. So, I cut that out. Um, Stopped drinking at home, so that was very, very helpful. And then, of course, limited, kind of red meat and pork, which was really tough to do. But, I maybe had like one hamburger for like 6 months, right? And I realized I didn't miss it, and so, like, okay, this is like not the end of the world. And yeah, since then, my last three quarterly checkups, um, all my both my cholesterol and my uric acid levels are considered within the normal range. So I might, you know, I'm sure, the dietary changes, were a big part of it, but I could probably attribute, the medication, as well, because that really kind of brought me back, to more normal lifestyle, and I have not had a flare up in about, I don't know, 2 years, 2.5 years. And when I had that flare up is because I went off my meds. I got too busy, forgot to refill my prescription, and I was doing fine, until I wasn't. And I even had to cancel a couple of trips, um, because I was immobile, right? And so, lesson learned. It took me, a couple, kind of difficult, hard lessons to learn, but now, I'm pretty much, mostly on the program, and so far it's kind of, it's kind of helped me live a more pain-free lifestyle.
Okay, well, I'll share my story. It's kind of similar to Mark's, but then I think there's some differences as well. So, my name is Joshua Unkprice. I am based in Northern Florida. And I was a PhilPro delegate in 2018, and then I'm also a Tayo co-founder. So, my story is that I first um, experienced gout in 2023 in June. And I remember this because I was visiting my family who's from Iloilo in the Philippines, and we went to Boracay. And for those who know Boracay, it's like a beautiful white sand beach. So I'm sitting there like walking on the beach, and my left toe, like left big toe, was so swollen and painful, and I was like limping, and I was like, what is going on with this? And I honestly thought that it had something to do with the flight. So just to like let me backtrack a little bit. Like my mom always had problems with gout. Some of my titos and titas also had gout, so it was clearly like very genetic within my family. And I wasn't super surprised that I got it, but just the way that it kind of came on so suddenly. I now in hindsight, I remember when we were on the plane, I was feeling a little bit of like stiffness and soreness in my left like big toe, kind of radiating up to my ankle. And I thought, well, like maybe I sprained it, or like, you're on a plane for 14 hours, maybe I like fell asleep and it was like in a weird position. And I just kind of, chalked it off to like Mark said, maybe it was just some type of like an injury. And I used to do taekwondo, and I would have um, injuries to my left ankle at times. So I kind of thought, maybe I did something to it, and it's like an old recurring, uh, injury or something. So here we are, like walking around on the beaches of Boracay, and I'm like super slow. Like I'm with my tita and my sister and my cousin, and I'm like 20 feet behind them, like limping because I couldn't walk. And I remember I was wearing flip flops, and that was so painful because it goes right there by your big toe. So I had to stop and buy like a different type of sandal, that went across the top of my foot, and it still like wasn't getting any better. Like I tried like icy hot, and because I thought it was some type of an injury. And my sister, who happens to be a doctor, like she's looking at it, she's like, Josh, I think you have gout because like this really looks like gout, and we know our nana has gout and our titos and titas have gout. And I was like, no way, it's not gout. Like, there's no way I have gout. It's impossible. Because unlike Mark, I don't eat a lot of the foods that I don't think for me there's like quite the same correlation with the foods that Dr. Solon-Ashby described. Like, I can't eat shellfish because I'm allergic to shellfish. Um, I do eat red meat from time to time. Um, but yeah, don't eat shellfish. I don't drink beer. So I'm just thinking, like, what could have caused this? And honestly, to this day, I mean, that was 2023, it's 2025, so that's 2 years I've been living with gout. I'm just now kind of figuring out what my personal triggers are as far as food. I think for me, it's more the sugary side of things, like the sugary drinks. Like if I have, let's say, a cocktail, like a mixed drink that's also sugary, like a vodka and orange juice. Like that's the kind of thing that I think would more trigger it for me. And then richer foods. I know Dr. Solon-Ashby, you didn't have a dairy on your list, but it seems like if I eat something with dairy that's also sweet, like ice cream or like cheesecake, like something that's rich and has dairy and also sugary and sweet, that what will tend to kind of cause me to have a flare up. So here we are in Boracay, and I'm really struggling. And we get back to Iloilo. Like it was miserable. I'm not gonna lie, it was miserable. I mean, we were trying to do all the fun things, and I just felt like I couldn't do anything. So we get back to Iloilo, and then one of my cousins, who's actually much younger than me, he was struggling with gout, and he had some colchicine. So he gave me some of his colchicine, and I want to say I took like two a day. And then like after like the second day, it pretty much went away. Like it went away really quickly. And then I found out in the Philippines, you can get colchicine over the counter. You don't even need a prescription. I could have gotten it like at the Mercury Drug in Morocco if I wanted to. But after that, got back to the United States, saw my regular doctor, was diagnosed with gout, and I was given colchicine for the flare-ups. Unlike Mark, who's on allopurinol, unfortunately for me, my mother, who also has gout, like I mentioned, she had a severe allergic reaction to allopurinol a few years ago. She actually did have Stephen Johnson syndrome. And it was crazy because she is a nurse. She's retired now, but she took her allopurinol that morning and then went to work and like blacked out in the parking lot. And her coworkers were wondering where she was because she was late and her car was in the parking lot, like kind of parked funny. And she was in the car, like passed out, like covered in rashes from head to toe. And she had to be rushed to the emergency room. I mean, it was really, really bad. Like she almost didn't make it, to be honest. So after that story, when my doctor first said, "Well, what about allopurinol?" I was like, "No, no, no. I think I think I'll pass on the allopurinol just because of the family history." So I have not really had a major gout flare up since that first one. I've been pretty good at when I start to kind of feel it coming on, like my kind of early warning systems. If I feel a little stiffness in my toes, I'll go ahead and take a colchicine for a couple of days until it goes away. Um, it doesn't always stay in my left foot. It kind of skips around. Like sometimes it's my left foot, sometimes it's in my right foot. But I can kind of feel when it starts to come. I actually had I would say like a mini flare a couple weeks ago, but it was in my pinky, like my pinky toe on my left foot. It just felt stiff and kind of strange. And I was like, I think this is gout. So I started taking my colchicine again, and it went away. But another thing I do, since I can't take allopurinol for maintenance, and doctor, maybe you could speak on this a little bit, like holistic methods. But one of my peoples actually told me to take apple cider vinegar and every day, and I for a lot of different health reasons, but also for gout. I can't quite stomach the taste; it's pretty bad. So I take the pill form, and that seems like it's helped control. Again, this is just kind of anecdotal evidence for me, but it seems like it's helped control my gout flare-ups to kind of keep those to a minimum. So now I try to avoid the sugary drinks. I try to avoid the sweets. I didn't realize that wheat was on that list. And now in hindsight, when I eat bread, that seems like that also may cause it to kind of start up again. But yeah, I just take my apple cider vinegar, and if I do feel a flare coming on, I take my colchicine, um, as needed until it goes away. So that's kind of my experience living with gout.
So, the principle behind the apple cider vinegar is changing the acidity of your body. So
Mm.
that's how it works. But do you know what your uric acid is?
Yeah, it's within normal levels
Okay,
now.
good. So then you really don't need allopurinol anyway.
Hmm.
So, um, and that's the thing is, if look, you're doing it holistically and you're fine. And then you kind of know what symptoms to watch out for and when to start the colchicine. So you're actually preventing a full-blown attack, which is good.
Yeah, and I cut all sugary drinks out of my diet. Like I don't drink soft drinks anymore. Really try to limit. I've never really had a sweet tooth, so I don't miss much with that. But limit intake of things like like I said, the ice cream or the cheesecake, like the rich, sugary, um, sweet desserts. And again, never been much of a beer drinker. But yes, I guess I'm kind of like Mark is watching what I eat, and then instead of the allopurinol, taking the apple cider vinegar to control it.
Mm-hmm.
Hey Josh, I just want to follow up on the sugary drinks kind of element of it. A doctor, you know, um, when I started sharing kind of my experiences, particularly within my professional networks, right, at conferences, a lot of people kind of are in this, age demographic, and they started sharing kind of that they, like Josh, right, suffer from gout, are on all sorts of different regimens. And one kind of thing I recently, was told about is tart cherry juice. So I have a friend who
Mm.
swears by it, and when he's traveling, such as when we would find ourselves at a conference and are surrounded by a lot of indulgent food and drink, that as an insurance policy, he'll go to the local grocery and stock up on tart cherry juice. And it's a very sugary drink. It's natural though. I'm just wondering, doctor, kind of, what's your take on, particularly, and it's not just tart cherry juice. They specify it's tart cherry juice. So, it's has the literature kind of addressed this at all?
That's anecdotal too, but I do have a patient who makes a trip to Michigan every year and comes home with cases of Michigan cherry juice because that's what he takes for his gout. So, like I said, different people have different metabolism. So, for some patients, for example, they can't eat peanuts then because they have a flare up. And if maybe Josh takes tart cherry juice instead of his apple cider vinegar, it might not work as well for him as it does for your friend. So, it's figuring out what works and what doesn't work, what precipitates an attack and what doesn't. But it's the same kind of basis for the tart cherry juice is changing the acidity of your system because that's changes in acidity will actually predispose you to developing, I mean, deposition of uric acid in your joints. So that's how that works. The rich foods, Josh, I don't think dairy's ever been associated. It might just be the sugar
Mhm.
with the rich foods. Or unless you've got this dairy hypersensitivity and it's not necessarily manifesting as the usual lactose intolerance, it's manifesting as gout, you know?
Yeah, I do have a dairy sensitivity as well.
Yeah, yeah.
Yeah.
So anybody
Uh,
else have any questions?
Yellow, like it's impossible. They're besties.
I don't know if anyone in the chat has a question or if you'd like to raise your hand and unmute.
Hi, my name is Gerard. I don't know where to raise my hand in the chat here, but thanks, Dr. Salon and Mark and Josh for sharing your stories there. I'm a clinical researcher, and I'm working on a new molecule for gout that's designed to lower uric acid, diminish tophi, and reduce the gout flares without renal safety issues. So, and I came on this webinar today just to see the experience of the Filipino community. I myself am Filipino as well. My dad and my brother have gout, and I'm working to try to make this product a reality. So, thank you again for sharing your stories. And anecdotally, that's what I've heard so far from all our patients. As far as what they're experiencing, what they're going through, what kinds of methods of treatment they're using. So I'm thankful that you're, able to share your stories, and helps me understand more about the need in our community for, advanced medications to help alleviate the pain that's caused by gout, and really the quality of life that is diminished by the disease. So thanks again. I just wanted to come on and say a few words. Thank you.
Thank you so much. And then Maria Beatty, would you like to ask a question?
Yeah, let me lower my hand. This is really, really illuminating, Dr. Solon, and yeah, and thank you, Josh and Mark, for your openness. My question has to do with kind of, I'm a therapist, and I'm wondering about like the stigma and like the kind of, it's kind of vulnerable to admit, that you struggle with gout, I think, and like, and the video kind of addressed the shame associated, and so just kind of like what do we, I mean, and also, so like a sort of different question where it's like, have we always had it? Has this disease always existed in the Filipino community? And is it just a Filipino American thing, or is it like in the Philippines, is this a struggle? Like, I'm just curious, like about like kind of immigration and how, the Filipino American diet is more, gives us more trouble than perhaps like, a more veg forward diet in the Philippines, or, fresh fish diet or something. I don't know. So yeah, a question about the social factors and the kind of mental health factors, and like the different, like, is this an American issue? And yeah, those are my questions. And I'm so proud. We're Clara's parents.
I know, I said.
Okay.
Yeah.
You should be proud of Clara.
We are.
So thank you for asking. But okay, so historically in the history books, gout was actually a what do you call that? I mean, rich people got gout because they were the ones who had all the red meat and all the rich foods, and so it was like a
yeah,
what do you call that?
I
Status
believe.
symbol. It was
Yeah,
a
I
status
believe
symbol.
Henry VIII was probably historically the most famous gout patient.
Yeah. And in fact, there's a painting of him with the big podagra attack. But so it's I don't I don't know about the stigma, but I think, like I said, the more we talk about it, the less it becomes as a stigma. Um there's multiple factors. So Asian Americans, actually, I didn't bring this up, between 2017 and 2018, the prevalence of gout in Asian Americans doubled just within 1 year. So our genetics, that's why ethnicity has a role. Our genetics play a role. Our diet, I mean, like, even if we live in America, we're still eating Filipino stuff. I mean, I do. Um, I don't really necessarily think that it's more common in the Philippines just because of our diet, but I know for a fact that we're maybe more conscious about, red meat and more fish products and not frying and grilling and all that because I don't know about you, but when I go home to the Philippines, I binge and everybody else is binging with me. So I think it's an interplay of different factors. And I I'm not sure how mental health plays into it though, but my patients who've had one, it only takes one attack for them to acknowledge that I have gout, help me. Because it's one of the, like Josh was saying, it's like a broken toe. So, or a broken bone. So, and there shouldn't be a stigma attached to it. So hopefully that's not gonna be true for too long. Did I answer your question?
Yes, thank you so much.
Yeah, just a bit on the stigma part. I think, we were kind of having a little bit of fun with this. Because, in my experience, I think, of any generation, um, I've not heard people kind of, feel kind of shame or try to hide, the gout itself. But I think maybe for a particular demographic who is aging, maybe this is more kind of just grappling with us finally being those titos and titas that for so long we had thought were just so much older than us, but time flies and we're here. And hence, the title of this program, and I think Josh and I think what we can afford to have a little poke a little fun at ourselves, right? If it gets the word out. So and so thank you, doctor, for also kind of noting that this is not just confined to men in their 30s, 40s, and whatever, that this affects our community at different stages. And so this is something that everybody should be aware of.
Yeah, I wanted to chime in a little bit on that. I think because in my family we had so much gout, it wasn't. I don't know if there was any stigma around it. But to your point, Ate Maria, this is just anecdotal, but my mom, out of all her brothers and sisters, definitely has struggled with gout the most. And we used to live in Arkansas, which is just north of Louisiana, where Dr. Solon-Ashby lives, and it's in the South, so lots of red meat, lots of fried foods. And I noticed that my titos and titas that do live in the United States, they seem to have more issues with the gout than my titos and titas that do live in the Philippines. And then my one cousin I mentioned, who is much younger than me, I have to throw that out there because it can affect anyone, people of all ages. I think he was like late 20s when he was diagnosed with gout, and I was 42 when I was diagnosed with gout. But he has always like loved American food, even when he was a kid. Like it's always like cheeseburgers, and we always joke that he lived in the Philippines, but he didn't like Filipino food. It was always like McDonald's and Jollibee. So I'm not surprised that he was the one that struggled with gout because he had basically an American diet, a lot of fried foods and red meat, and sweets and all that. So again, I don't know. That's just anecdotal, but it does seem to me that within my family, at least, those who are exposed to a more American diet seem to be the ones that have more instances of gout. And then finally, to the mental health aspect, I mean, I would say it did affect my mental health because here I was on vacation, supposed to be having fun, and I'm struggling with gout. So for me, it's just feeling that I'm relatively young, like I'm relatively healthy, like never had any health issues, like work out, try to eat well, and then here I am, like hobbling along, and my 70-year-old tita is like walking faster than I am. So, and then I just remember when my mom would have attacks of gout, and she would have it severe, where she, almost couldn't even walk for like 2 weeks, 3 weeks at a time, and had to wear like an ankle brace and, you know, use a cane, or even, I think a couple times had to use a wheelchair because it was just too painful to walk. So I think maybe it's just, grappling with the flare ups that making me feel like I guess you have FOMO, like if you're missing out, you feel like yeah, like I'm too young to be incapacitated like that. I think that's what for me, affected my mental health.
Thank you so much, all of you, for your answers and everyone for your questions. And thank you to everyone who is registered and for your engagement with this webinar. So really quickly, I'd like to turn it over to Lizelle for a little bit of more information about TIO, PhilPro, and some of our other resources.
Thanks, Clara. So yeah, a big shout out to our parent org, PhilPro, who helped incubate TIO to what it is today in terms of started out as a rapid response to COVID and now covering a lot of different, public health and media literacy topics. I want to make sure that everyone has a link here to give us some feedback. We've been doing a series of webinars the last couple of months. Feedback is a gift. We really appreciate everyone that has signed up. So we want to continue to improve and keep covering the topics that matter to us as a community. So I know this came out very organically within our team, and we had a really good response in terms of, attendance here. So thank you everyone here. And then I want to shout out one other event that we do have coming up. It is our TIO Youth Summit on September 13th. It's virtual, it's free. I hope you all can attend. This is another TIO fellow-led program by our high school students. So I hope everyone could check that out as well. And a big thank you to all, to Krista, Clara, Dr. Solon, Mark, and Josh for a very informative webinar, an hour. I hope everyone had a chance to learn something new. And I think the takeaway here is that we've got to talk about these issues so that we take away any stigma that may remain and whatnot. So thank you again. And I don't know if Dr. Solon, if you had any last thoughts, or Mark or Josh.
I don't, but if I'll give you my email address if you all have any questions. It's agnesash@aol.com. So just shoot me an email and I answer pretty quickly.
Yes, and we'll send a recording of this webinar right after, and we'll also post it on our website. But please fill out the feedback form. We really appreciate any feedback you can give us. And thank you again for joining us tonight.
Thank you. Salamat.
Thanks for doing this. Bye.
Thanks, guys.